We often think of our bodies as a bunch of separate parts, right? If your knee hurts, you go look at the knee. If you've got a headache, you focus on your head. But what if that's not the whole story? What if your jaw and your pelvis, two areas that seem totally unrelated, were actually having a secret conversation? A conversation that could be the key to unlocking chronic pain. Well, today we're going to listen in. It sounds a little wild, doesn't it? I mean, your jaw is up here handling all the chewing and talking. The pelvic floor is, well, it's way down there, doing a completely different job. And yet, there's more and more evidence piling up that suggests a really deep connection. So could treating something like a clenched jaw actually improve your pelvic health? Let's find out. Okay, here's a great way to picture this. Think of your body like a full orchestra. Every muscle, every joint is a different instrument. Now, if the violins, let's say that's your jaw, are completely out of tune, it doesn't just sound bad on its own, does it? Nope. It can throw off the rhythm of the entire performance, even affecting the drums way on the other side of the stage, and that's your pelvis. And look, this isn't just some nice metaphor. For years, clinicians, the real boots-on-the-ground experts, have been noticing a really strange pattern. And this is the first clue in our little scientific detective story. So physical therapists and doctors started seeing this odd thing happening over and over again. Patients would come in with jaw pain, you might know it as TMJ dysfunction, and they'd also have pelvic floor issues. And as researchers looked closer, they found specific links. Teeth grinding was connected to painful intercourse, and women with endometriosis often had both pelvic pain and TMJ pain. This was just happening way too often to be a coincidence. There had to be a reason, a physical connection. To crack this case, we have to look for a hidden clue, some kind of anatomical structure that could possibly connect these two distant parts of the body. And guess what? We found one. Everybody, meet our prime suspect, the deep front line. Now, this isn't a single muscle you can just point to. Think of it more like a continuous train of fascia. And what's fascia? It's that thin, web-like connective tissue that wraps around, well, pretty much everything inside you, your muscles, your organs. This particular line runs right through your core, acting like a hidden superhighway that sends tension all over the body. And this is where it gets really cool. Check out the path this highway takes. It literally starts at the bottom of your feet, runs up the inside of your legs, goes directly through the pelvic floor, keeps on going up through your torso and your diaphragm, and it ends, you guessed it, right at the muscles of your jaw. It's a direct physical link. The smoking gun. Okay, so we've got a solid theory and an anatomical suspect. What's the next step for any good detective? You've got to run an experiment. And back in 2024, that's exactly what a team of scientists did. They set up a really smart experiment called a randomized controlled trial. They took 47 women who were all dealing with TMJ pain. They split them up. One group, the experimental group, got a 15-minute therapy session focused only on the soft tissue around their jaw. The other group, the control group, just chilled out and rested for 15 minutes. The process was super straightforward. First, for every single person, they measured their pelvic floor muscle activity using some pretty high-tech tools. Next, the intervention happened, either the jaw therapy or the rest period. And then right away, they measured those pelvic floor muscles a second time to see if anything at all had changed. So what did this therapy actually feel like? Well, as you can see, it wasn't anything aggressive. It was all about a gentle, targeted release of key jaw muscles. You can actually feel them right now. If you clench your teeth, you'll feel the masseter and temporalis muscles bulging. The therapy was focused entirely on that one area, just using precise soft tissue techniques. All right, the experiment is done, the data is in. So what was the verdict? Did massaging someone's jaw actually do anything to their pelvic floor, all the way on the other side of the body? The very first clue came from the ultrasound. After just 15 minutes of jaw therapy, the pelvic floor muscles in that group showed an incredible 52.94% increase in how much they could activate during a contraction. Now, in the world of science, this specific result didn't quite hit the high bar for what's called statistical significance. But an effect this big is still a really powerful signal. It strongly suggests that releasing the jaw could help wake up the pelvic floor, making it easier to contract. But hold on, because that wasn't even the biggest finding. The most powerful evidence, the real game changer, came from what happened when the muscles were supposed to be at rest. Just look at this chart. It shows the tension in the pelvic floor when it's not contracting. The control group on the right, not much change. But look at the therapy group on the left. Their resting tension dropped, and it dropped significantly. They were actually able to relax more. And this is the crucial point, right here. We're always so focused on strengthening the pelvic floor, but a muscle's ability to relax is just as important. A healthy muscle has to do both. If your pelvic floor is constantly tight and overactive, that can cause a ton of pain and problems. This study showed that treating the jaw directly helped the pelvic floor to finally let go.
And hey, don't just take my word for it. The study's authors said it perfectly themselves. Quote, a single session of temporomandibular joint soft tissue therapy significantly enhances the ability of the pelvic floor muscles to relax. The connection wasn't just a theory anymore. It was real, and it was measurable.
So what's the big takeaway for you in all this? First, your body is not just a collection of parts. It's one deeply interconnected system. Second, if you're dealing with pelvic issues, especially pain or overactivity, maybe, just maybe, looking at your jaw tension is a missing piece of the puzzle. We all know that stress makes us clench our jaw, right? Well, that same stress can make us tense our pelvic floor without us even knowing it. And this shows that treating one end of that stress reaction, the jaw, can directly help the other end. It all proves that taking a holistic approach, looking at the whole picture, is absolutely vital. The place where you feel the pain isn't always the source of the problem. And it leaves us with this really fascinating question. If the jaw and the pelvis are this connected, what other hidden conversations are happening inside your body that you might be completely overlooking?